Hello, and welcome to this National MS Education and Awareness Month teleconference, hosted by MS Focus, the Multiple Sclerosis Foundation, and made possible with support from EMD Serono, Genentech, Mylan, and Sanofi Genzyme. I'm your host, Casey Minnis, Director of Communications for the Multiple Sclerosis Foundation, and I'm joined by Dr. Mitzi Williams, who will be talking to us on the topic of MS Made Simple. There are no slides accompanying tonight's presentation, but at the end of the presentation, we will have an opportunity for question and answer. The questions can be submitted using the online chat feature, so we encourage you to connect to the conference online. In order to connect, go to readytalk.com and enter the access code 7766805. That's readytalk.com and the access code 7766805. Now, let me take a moment to introduce our speaker. We're joined by Dr. Mitzi Joy Williams, who is a neurologist and multiple sclerosis specialist in Atlanta, Georgia. She received her undergraduate degree in neuroscience and behavioral biology from Emory University and her Doctor of Medicine degree from Morehouse School of Medicine. Dr. Williams completed her internship and residency in neurology, as well as a clinical fellowship in multiple sclerosis at the Medical College of Georgia in Augusta, Georgia. After several years of serving as the medical director of the Augusta MS Center and assistant professor in neurology, she returned to Atlanta, where she joined the Multiple Sclerosis Center of Atlanta. She served there as a staff physician and researcher for over 7 years. Dr. Williams has a strong interest in understanding and furthering research in MS in ethnic minority populations. She is a sought-after speaker and presenter and has discussed her research both nationally and internationally at various scientific meetings. She's spearheaded and participated in multiple steering committees and work groups to further research in underserved populations with MS. She also has recently increased involvement in efforts to increase diversity in clinical research and to educate the community about the importance of research participation. Dr. Williams is the author of MS Made Simple, the essential guide to understanding your multiple sclerosis diagnosis. Because of her passion for teaching and advocacy, Dr. Williams will be joining the faculty of her alma mater, Morehouse School of Medicine, in 2019. Dr. Williams, thank you so much for being here tonight, and I turn it over to you.
Absolutely. Thank you so much, Casey, and good evening, everyone. As Casey said with that lovely introduction, my name is Dr. Mitzi Joy Williams. I am a neurologist and multiple sclerosis specialist, and I'm here tonight to talk a little bit about my book, MS Made Simple, but really kind of more about the themes related to the book, including self-advocacy and research participation. I'm very grateful to my friends from the MS Foundation, including Casey and Natalie and Deborah, for inviting me to talk with you all tonight. I bid you greetings from North Carolina, which is not my home, but I'm visiting to do a lecture tomorrow, and it's a little rainy here. I left the sunshine in Georgia, but I hope that you all are enjoying your Friday evening so far. So I'm just going to start out by talking a little bit about my passion for MS, because that's a common question that I get, and then I'll talk a little bit about the book, and then we'll take some questions at the end. So I'm hoping that we have some good interaction this evening. So as Casey said, I went to Emory, and then I went to Morehouse School of Medicine, and I did neurology training. I hung out in Georgia, which is my hometown, for most of my training. And so I got very interested in neurology and in the brain probably during college. And so I found this fascination for the brain. I took this really cool class called Drugs and Behavior, and although some people were a little more interested in some of the drugs part, I was a little more interested in the brain part. And so that kind of started my love of neuroscience. Finally wound up doing neurology training in Augusta, and I have the very great fortune of meeting Dr. Mary Hughes, who is my mentor, and also did my MS fellowship with her, and I just really loved working with people who have multiple sclerosis. I love the camaraderie. I love the fellowship. I love the connection with my patients. But I also love the challenge because if you've been living with MS, you know that everybody's different. And so I became very passionate about advocacy. I became very passionate about treatment. And I think it's so amazing because there's been so much change that's occurred, even over the past 10 years, the past 10 to 15 years since I've done training. And so it's been a really exciting journey because there's so much more that we could do there's so much more that we can do now than we could do even, 7 or 8 years ago. So MS Made Simple was born out of a couple of different things. So in my time with patients, I found that I spent a lot of my time educating people, and so the majority of our visits would be kind of education. And I think one of the things that was very striking to me is that whether people had had MS for 5 minutes, meaning I just diagnosed them, or sometimes whether they had it for 15 years, I found the same questions coming up over and over again. And I found myself spending a lot of time educating people about what MS is and how it affects the body, even though they had the disease for a very long time. And so I began to ask every new patient that I saw, well, tell me what MS is or tell me your understanding. And I found that a lot of people really couldn't kind of talk to me, to their level of understanding about what it was. And so that was one of the first things that I noticed. And so I began to try to find ways to do more education. I began to get involved with different programs, especially with the MS Foundation, educating people about multiple sclerosis. But I began to have a desire to do it on a bit of a broader scale. And so that's kind of how the idea for the book was birthed. I think the other things that are very important is that I have realized from interacting with people over many years that self-advocacy is so important, because you are your own best advocate, right? The knowledge that you have of the condition, of the treatments that you're taking can help inform further treatment, right? So it's important to understand, to the best of your ability, what the disease is doing to your body, and then also to understand the importance of dealing with certain symptoms, when to contact your doctor, when to contact your healthcare team, and so that can help direct your treatment. And I think one of the other important things that has also changed over time is this idea of shared decision-making. So, we used to say a long time ago, they had that old saying, an apple a day keeps a doctor away, and, back in the day, the doctor would just tell you this is what you're going to do, and you would go home, and sometimes you do it, and sometimes you wouldn't. But that paradigm has changed from medicine being very paternalistic, meaning we tell everyone what to do and then they're supposed to go home and do it, to now more of a model of what we call shared decision-making. And I think that this is so important, especially for a chronic disease like multiple sclerosis, because the medications that are prescribed do have side effects. They do have effects on the body, and it's so important for you to be a part of that decision-making, to understand what you're doing, why you're doing it, to make sure that you're checking in, talking to your team, letting them know if things are not going right, so that you all can come to a decision together about what's the best treatment. And I want to also stress the importance of shared, because what it means is it doesn't mean we go from one extreme to the other. So we don't go from paternalistic to necessarily a person dictating what they think the doctor should do. It's kind of sitting down, bringing your heads together. You trust the expertise of the person that you're working with, and then you all come to that decision together. So I think the first key to being a part of your healthcare team and advocating for yourself is certainly understanding the condition, but also building a trusting relationship with your healthcare team. One of the reasons, as I said, that I went into MS is because it really is a relationship and a journey with the people that I serve. And so you have to have some trust in the person that you're dealing with and the expertise of the physician or healthcare team that you're dealing with, so that you can tell them what's going on if you're having problems, or tell them if you stop taking your medication, or tell them if you're concerned about things, so that that can help direct treatment. I think the other thing to keep in mind is that you are the best expert on your own body. And if we don't know that things are going wrong, then we can't help deal with those things. So it's about a balance, right? So making sure that we have those checks and balances, that you're understanding to the best of your ability what's going on, and that you also build a trusting relationship with your healthcare team so that you all can make those decisions together. And then the other kind of key message that I talk about in the book Summer that is also a passion of mine is research participation. And this was really a passion that kind of came, I won't say came out of nowhere, but was not something that I would have thought of for myself even 10 years ago. I remember as a college student, I went to my pre-med advisor and I asked them if I could get into medical school without doing clinical basic research, and they said yes, and I was like, great, because at the time I wasn't interested in basic research. And although I do mostly clinical research now, I've realized over time the importance of research participation. And I think that this interest or passion came about for a couple of reasons. One of which I've always been involved in practices that deal with clinical research and always looked at the results, which has led many of our treatment decisions in the MS community. But I think also it's become a passion because of the things I've realized that we're lacking. So for instance, I do a lot of research looking at MS in the African American community because I live in Atlanta, Georgia, and I noticed that a large proportion of the patients that I would see, probably 40 or 50%, were African American. And so this was a group that we thought traditionally didn't get MS. And not only did we think they didn't get MS, but what we saw from the literature or the small amount of studies that were done is that there was some suggestion that MS was a little bit worse in that population. And so as I began to do research to look for studies to try to understand better what I was seeing in my patients, I realized that there wasn't really very much research at all. And I was very fortunate to participate in an article, a publication with some of my colleagues discussing MS in several ethnic minority populations, including African Americans and people of Hispanic or Latino descent. And what we found was that out of over 60,000 articles about MS that had been published, over the years, there were only about 100 articles about MS in minority populations, which is not very much. And so that kind of led me on this journey to start talking about research in underserved populations. And there are a couple of major underserved populations, one of which I think certainly is ethnic minority populations, but another one that certainly is becoming more recognized is people over the age of 50 with multiple sclerosis. As our treatments are getting better, people are living a long time with MS. And MS, is a disease that potentially could shorten the lifespan slightly, but generally people live fairly normal lifespans. And so most of our studies are done on people who are less than 55. And so if you look at the criteria for all of our studies, everybody's less than 55. But there are changes that we see as we age with the immune system and with our bodies, and we really don't have a good grasp of the effects of how that affects the immune system, how that affects MS, how that affects our treatment regimens, if we should be adjusting them as our population gets older or more mature, as I like to say, because the older I get, the older it takes for me to think someone is old. So those are two of the populations that I think are very underserved in terms of clinical research, and so I certainly have been very vocal about trying to educate the community about research, also to try to encourage people to be involved in clinical research to the extent that they feel comfortable. Certainly, clinical trials are very important, and they have certain criteria, but there are a lot of other ways to be involved in research, whether it's through registries. There's some amazing registries out there, including things associated with the Accelerated Cure Project or I Conquer MS, or there are some regions of the U.S. that have registries, but it's so important to get involved to the level that you can so that we can try to understand MS better and ultimately so that we can try to find a cure for MS, because that's our goal. I think the other reason that research participation is so important and so key is that over time, one of the goals of medicine in general is to move toward what we call personalized medicine. So there are a lot of super smart people doing bench research who are looking for biomarkers, what we call biomarkers with multiple sclerosis and other diseases, meaning are there tests that we can do that will tell us, for instance, if someone's having a relapse, that will tell us, for instance, if someone's medicine is not working. Are there tests or markers that we can use that will tell us what's the best medication for this person, what dosage might be the best medication for this individual person. And so all of those discoveries are based on research. And so if only a small number of people are involved in research, or if only people of one, let's say, ethnic population or one age group are involved in the research, then we may be missing out on some of the keys to help us to understand those things better. And it also may make it a little bit more difficult to apply the results to everybody. And so that's, why, I talk a lot about research participation and how that's so important. So the key messages overall are about self-advocacy, making sure that you educate yourself, being part of your healthcare team, an active part, so shared decision-making, and then also if there is an extent that you can be involved in research participation, being involved in research. So that's so important. So I'm just going to go a little bit into more detail about MS Made Simple, which is my book. And I'm going to read the dedication to you guys because I think that this is kind of the main motivation for the book. And it says that this book is dedicated to the many wonderful people who allow me to be a part of their family and take part in this journey with them called MS. We laugh, we cry, we hope, we pray, and we dream together. It will always be my privilege and honor to serve you. And I think that is so key because it really is a service. We as physicians serve, the people that we come into contact with on a regular basis. And so we want to make sure that we're doing the best that we can with the knowledge that we have to try to treat MS. So the way that the book is framed is really in a series of questions, and most of them are questions that I frequently had people ask me in clinic, and some of them are questions that I have had as a physician and as a researcher. So I'll just kind of briefly go through kind of an outline, and then we'll take some questions toward the end. So I started out with, what do you mean I have MS? And so MS, a diagnosis can be either a shock or a relief, or sometimes a combination of both. So when people would come into the office and say, what do you mean I have MS? Some of them would be blindsided because many times people who come to diagnosis, especially in their 20s and 30s, are kind of at the height of life. They might be in their careers. They might be finishing college. They might be getting ready to start a career, in the middle of raising a family. And sometimes the diagnosis will come out of nowhere because the symptoms can be very sudden. So, someone may be kind of minding their own business and lose vision in one eye. And so it can be very frightening, especially because many people who are initially diagnosed are very healthy and have never had health problems. And that is such a common theme that I've seen out of the, hundreds of patients that I've come into contact with throughout my practice. And so what do you mean I have MS? It's just kind of a general overview about what MS is. I do not go into an immunology lecture, but certainly I try to, describe it as an autoimmune disease and kind of how the immune system attacks the myelin and how that results in the different symptoms that are related to MS. And then we go into a chapter where we talk about how MS is diagnosed. And again, diagnosis can be sometimes a shock or a relief. There are some people who have had other issues, like they may have had a car accident and gotten an MRI and had lesions that look like MS, or they may have had headaches, and that may have led to kind of the journey to diagnosis for MS. There are other people who may have been having symptoms for years and been searching for diagnosis. I think that one of the good things about advances in technology, especially with MRIs, are that we can diagnose people a lot earlier than we used to be able to. I think the other thing that helps is that the diagnostic criteria, the basically set of rules that we use to diagnose MS, have also changed over time. So way back in the day, I won't say way back in the day, but, let's say 20 or 30 years ago, if someone had a symptom that looked typical of MS, we would essentially wait for them to have another symptom, or physicians would essentially wait for them to have another symptom before diagnosis, because technically you have to have multiple sets of symptoms for diagnosis, or multiple multiple areas of evidence of immune attack on the central nervous system. And so that changed over time to where a person would have a symptom that looked like MS, and then maybe we would repeat an MRI in a couple of months, and if there were new spots on the MRI, then we'd say, okay, now you've got MS. And so now the diagnostic criteria has changed so that if a person has symptoms plus they have new and old spots on their MRI, we can diagnose them all in one visit, technically, right? And also the thinking pattern has changed for people who have that first episode of MS and they have an MRI that looks like MS. We now treat those people officially as well. So what we understand over time is that the earlier we start treatment, the better. So the criteria that we use to diagnose it has improved, and also our tests have improved. You know, MRI used to be very difficult to access even 15 or 20 years ago. I remember as a student and as a resident, in order to get a brain MRI on somebody, they better have something really serious going on, like, you know, some type of trauma that you're aware of. You have to have a really good reason to order it. Now, you'd still have to have a good reason to order it, but we're able to get much more access to MRIs earlier so that we can diagnose people instead of waiting long periods of time or waiting years before someone's diagnosed. So MRI is very important, seeing a physician, an exam, and there are other tests that can be done that can help us with diagnosis as well, including a spinal tap or a lumbar puncture. Whenever I give lectures, I always ask, not always, but sometimes I ask people, has anybody ever had a spinal tap? And then I ask, does anybody not remember if you had a spinal tap? And if anybody raises their hand, I always say, you haven't had one, because if you had one, you will not forget it, right? It is not a pleasant experience, and you certainly don't forget it. So certainly a lumbar puncture is one of the tests that we use if the MRI or other tests aren't clear. And so in the next chapter, I talk a little bit about what type of MS do I have and how can I plan for the future, because there often is a lot of uncertainty. So if the symptoms are there and they go away, there's concern or fear that they'll come back. If the symptoms are there and they don't go away immediately or very quickly, then there's concern about, well, will they go away? Will I get back to normal? Will I be able to work? What should I do? You know, and so there are a lot of questions surrounding that, so I address that. And then also when people ask about what type of MS they have, we have several categories that we use to talk about MS, but those categories really aren't perfect. And what we're finding as a scientific community is that MS is a lot more complicated than kind of those box and graphs that you see with the squiggly lines where we show relapsing remitting, where we show secondary progressive or primary progressive. Often there are multiple things going on at the same time, and it's not as clear-cut as you would think. In the next chapter, we talk a little bit about how we treat MS, and I don't necessarily focus specifically on specific treatments. I don't list specific treatments. I talk a little bit more about the ways that we address treatment, whether it's addressing relapses, whether it is talking about disease-modifying therapy. Those are the medications that can actually affect the course of MS. We also talk a little bit about symptom management, how we can affect someone's everyday life, and then a little bit about rehabilitation as well. In Chapter 5, I talk about if there's no cure, why should I start treatment? And again, that often is a very common question. Not only if there's no cure, why should I start treatment, but my symptoms went back to normal, I feel fine, why should I start treatment? And so we talk a little bit about the goals of therapy in terms of affecting, the overall course of disease and decreasing disability. And then we also talk about how disease-modifying therapies do not necessarily affect symptoms that are already there. In Chapter 6, so we got 10 chapters, so just a couple more. So Chapter 6, I talk a little bit about, but you look so good, how can you have MS? And that's something that many people say to a lot of my patients, especially people who may have had symptoms that resolved or who may have what we call silent symptoms of MS, like fatigue or cognitive dysfunction, things that you can't necessarily put a finger on, things that aren't as obvious as if someone were dragging a leg or had some type of obvious weakness or some type of visual problem. So we addressed some of those silent symptoms of MS in that chapter. And then in the next one, the question is, say what? I didn't know black people got MS, and so I talk a little bit about MS in the African American community and some of the research that's been done and some of the trends that we see, but I also talk a little bit about some of the needs that we have and some of the questions that still need to be addressed in this community. Also, the next two chapters talk about research. One is about why should I participate in research and why is there so little diversity in clinical research. And I talk a little bit about kind of the phases of research, the type of research that people can be involved in, and then also the importance of seeking out resources in your community, whether it's through your physician, whether it's through amazing organizations like the MS Foundation, that can direct you to where people are doing studies that you maybe could be involved in, whether it's, a study about diet or it's a study about exercise or a study about quality of life. There's so many different ways to be involved, and I like to say get in where you fit in, if you've heard that phrase before, because, again, clinical trials are not for everybody, but there is some way that everybody can be involved and participate in furthering our knowledge so that we can understand and fight MS more effectively. And then I talk about diversity in research, which I touched on a little bit earlier during the discussion, and why it's so important to have diversity in research, not just necessarily in ethnic populations, but also in age ranges. Fortunately, over the past year, the first medication was approved for indication in the pediatric population, but until before then, we didn't have any medications approved for pediatric MS. And so, again, we need a better understanding of how the disease works in the more extremes of age, right? So in the younger population, but again, also in the older population, although I don't think that 55 is that old, but people over the age of 55. So we need to understand more in those extremes so that we can learn to treat more effectively. And then we also need to understand more about people of ethnic minority descent, whether it is MS in the Asian population, MS in the African American population, MS in a variety of Latino populations as well. And then I like to end it with, what can I do to help myself? And so, again, this circles back to the original theme, and kind of some of the things that led me to really, finally dig in my heels and write this book, because I think that it's so important to understand that medicine doesn't do everything for us, right? So, we as physicians and as healthcare providers, offer the best interventions that we can to the best of our ability, but that only plays a part in your overall health. And I always like to say that medication plays a part and you play a part. And no medication is ever going to eliminate the part that you play in your own health and wellness and taking control of your MS or other chronic diseases if, people have other chronic diseases. So there are things that you can do to help yourself, whether it's eating a well-balanced diet, whether it's exercising as much as you can, right? Kind of reframing our thought of exercising, meaning exercise does not have to be an hour in, spandex on the treadmill. It can just be little changes, little increases in activity over the course of the day. We're learning a lot more about MS and diet. We're learning a lot more about the gut and the way that the things that we eat possibly educate our immune system to cause more inflammation or trouble or damage. And then also other things like quitting smoking, other things like forming a community of support, whether it's through organizations like MSF that helps people start support groups, finding that community, finding that support, finding that voice, and recognizing that life after MS does look different. I generally like to say that MS is not a death sentence, but it is an adjustment sentence. And so that adjustment looks different for different people. But there is always something that you can do, and there are ways that you can be a part of the community and ways that you can help others, regardless of your level of disability with multiple sclerosis. And so, again, making sure that you understand things that you can do for yourself to improve your overall health, ways that you can partner with your healthcare team, and ways that you can continue to increase your knowledge and continue to be a part of that shared decision-making process. And so that's essentially just kind of a brief overview of the book. It's a very quick read. I call it Cliff Notes. And I made it that way intentionally because so many times we get really big, thick books that look great and have nice, pretty covers, and then we never read them. And so this is a really easy read meant to really give people kind of an overview about the disease and kind of trigger some of those questions about things that you may want to go and delve into more research with. I also created it as a resource for family members with MS because oftentimes when people come to their visits with the neurologist, sometimes their family members can't come. So sometimes their spouses can't come. Sometimes the other family members, their other support partners may not be able to attend the meetings but still have a desire to learn more about the disease. Or there may sometimes, especially with those silent symptoms of MS, be things that family members or part of the care network may misunderstand. And so, I also wanted it to be a resource for people who were affected by MS, not necessarily have the disease, but who are affected, meaning their loved ones and friends and support partners, because there's also information that's needed in the community because MS is not a disease that just affects the person who has it. It affects their whole community. It affects the whole family, right? Depending on the symptoms that occur and how they happen, it may affect their roles within the family, their roles within their support system, and it may change at some points from them being the person that's always supported people to them needing others to support them. And so there are a lot of dynamics that need to be addressed. And so it's important that everybody, again, to the best of their ability, knows what's going on and is able to educate themselves to the best of their ability. And so with that, that's just kind of a brief overview of the book, a little bit about what I talk about. If you would like to obtain a copy of the book, there are a couple of ways that you can do that. You can purchase a copy at www.msmadesimple.com, and so you can purchase an autographed copy there, or the ebook is available on Amazon. Within the next couple of weeks, there also will be an audio book available, which I was very excited about. It's very interesting because I have traditionally been a singer, and so I've always done a lot of work in the recording studio doing singing, but I must say that talking is a lot harder than singing, if you will believe it. So recording the audiobook was a lot of fun, but it was a lot more challenging than I could have imagined because when you don't have music, you can hear every click and every bit of, noise and all that kind of stuff. So it actually was a very cool but interesting experience. So the audiobook will be available within the next couple of weeks on iTunes, also on iBooks, and on Audible. And also, if you want to keep up with Dr. Mitzi and what I have going on, I do live streams every week on YouTube. I also I post them on YouTube, but I do them on Facebook, so I do a Facebook Live every week talking about different topics related to MS. Some of them, again, are questions that people ask me regularly in the office, and other times there may be questions that people who follow me on social media may ask. And sometimes I do a kind of Ask Dr. Mitzi question session as well. And so if you follow me on social media, my handles are Dr. Mitzi Joy, MD, DrMitziJoimd. And that's my handle on all social media, and also is the address to my website, drmitzijoymd.com. So with that, I will take a breath, and then I will see if there are any questions that people have. We'll take maybe 10 to 15 minutes of questions, and then we'll see where we go from there. Thank you guys so much for your time and attention. And Casey, I guess we can open it up for questions.
Okay. Thank you so much, Dr. Williams. Well, I'm looking at our crowd tonight, and I see that the vast majority of them are not online, that they are actually on audio only. So we're going to try something a little bit different. What I'm going to do is I'm going to unmute our audience. I'm going to take their lines off mute. Now, listeners, if you would like to put yourself back on mute, if you're in a noisy environment, you can hit *6 on your phone. But that way, anybody who's live on the line can go ahead and ask any questions that they have. So I'm going to go ahead and do that right now.
Perfect.
The conference has been unmuted.
All right, folks, you are on the line with Dr. Mitzi Joy. Do we have any questions?
Don't be shy.
I feel like we've got a question that maybe I can't quite hear the person, or is that background noise?
I think it's background noise.
Okay.
Sounds like a radio or something like that.
All right. Well, I had one question.
Sure.
You talked about how with research participation, there's a problem that most of the studies, the cutoff age is age 55, and so there aren't really studies on aging with MS. What is the solution to that? Will studies be done that specifically look at a population 55 and older, or will that age restriction need to be changed where a wider range of people are getting included in the studies?
Yeah, so that's a great question. So I think probably the answer is going to be a combination of both, and I think that the reason that this is particularly important is because, the traditional thinking about MS, at least what I was taught in residency training, was that MS burns out after a certain age. And so the thought was that, people would have, the inflammatory part of MS where they have the relapses, the MRI changes early on, and then after a while it just kind of fizzles out. And so I think that the way to approach it is, number one, addressing some of the age restriction in the studies. But I know that there are a couple of studies that people are looking at treatment in people over the age of 55 and whether, we should continue treatment or whether we should stop treatment or, what we should do. So I think there'll be a combination where people will do studies, especially at some of our larger academic centers, where they look at specific issues in that population. But I think that also there will have to be a push from the community to increase the age range of some of our studies so that we can see how the medications are working or what some of the combination of issues are as the immune system ages with our medications.
And another question that about the research that you mentioned, you had mentioned that there are various ways to be involved, and that could be being in a clinical trial, where obviously they're trying some sort of intervention. But you also mentioned participating in registries. Can you explain for folks a little bit about what that means, what it takes to participate in a registry?
Absolutely. So registries are started by a variety of organizations. Oftentimes they are associated with people who, see the physician at certain facilities. So for instance, there's a large registry in New York. So the New York consortium of several centers, MS centers, had a registry or has a registry where people can enroll to, and the goal of registries is really to collect a certain amount of information in a large population of people. Registries are very common in the U.S., but, fortunately or unfortunately, in the U.S., we don't have a nationwide registry, which is one of the difficulties with collecting information about MS. And in other countries, for instance, they often have a nationwide registry. So everybody who has MS is in the registry, so they can really get a lot of information about how patterns of treatment change or how people are doing on certain treatments or how their MRIs are changing because everybody's involved. So the goal of registries is to collect different types of information. Some of them collect information, usually it's through the form of surveys. So the surveys are usually done on the computer. Some people still do them by paper, but they're usually done on the computer nowadays. And so they will ask different questions about like your age, when you were diagnosed, when your last MRI was, They may ask questions about your treatment, how many treatments you may have taken, what treatment you're taking. And again, the goal is to try to understand trends in the disease better. And so, that also is an effective way of collecting information from people of different age ranges, because in a registry, we're collecting, just kind of general data about people's MS and about their condition, and often they also will send follow-up surveys, whether it's every 6 months or every year, to see how things are changing. And so that is one way that we can collect information about those extremes of age and about different populations, because the requirements are not as strict for a registry as they would be for something like a clinical trial.
Okay. Thank you. All right, I just want to remind our listeners your lines are live. If anyone has a question for Dr. Williams, please speak up now. Okay. Well, I have one final question for you.
Sure. Sure.
You talked a little bit, too, about personalized medicine, where looking for biomarkers where they'll be able to tell, is this a relapse, or perhaps is this medicine going to be effective for this person? How far away do you think the practical use of those kinds of things is? How far in the future are we talking for personalized medicine?
Yeah, I think we still have a little ways to go, right? And I think it also depends on the disease process, right? I think for MS, we still have a little way to go in terms of biomarkers. There actually is an MS conference going on, probably should have been ending tonight or tomorrow in Dallas, that's talking a lot about personalized medicine. And so, one of the difficulties with biomarkers is that we just haven't really found one that kind of across the board has given us good information. There's one that's a little promising called NFL, and not the National Football League, but it's a different NFL. There's one that's being looked at to see if it can be a marker for possibly relapses, also a marker to tell us about how people are doing with their medication, but one of the challenges with MS is that it sometimes is difficult to know what's going on in the brain based on tests that are done in the blood, right? So one of the good ways to figure out what's going on in the brain is by looking at the spinal fluid, and nobody's going to sign up to do spinal taps every so often to get the information. So that's been one of the challenges, is finding a marker that we can do, like with a simple blood test, that will tell us what's been going on in the brain, because there's a barrier that blocks things from, between the brain and the blood. And so I think that's been probably our biggest challenge, is finding one that does that. But I think we still have a ways to go. So hopefully within the next couple of years or so, we will find at least one good biomarker to help us. So I'm very hopeful for the one that we're looking at now.
All right. Thank you so much. Well,
Perfect.
I'd like to say thank you to all of our listeners for being here with us. This is not the only teleconference that we have going on this month. For National MS Education and Awareness Month, we have a whole series. Our next teleconference will be on March 5th, and Herb Karpatkin, a doctor of physical therapy, will be talking about flexing your MS muscles to remain mobile. So if you missed any part of tonight's discussion, it will be replayed on msfocusradio.org and available on demand. And you can follow MS Focus on Facebook, Twitter, and Instagram for times and access information. I'd like to extend our sincere thanks to our sponsors for their support of National MS Education Awareness Month, to all of our listeners for calling in tonight, and especially to Dr. Mitzi Joy Williams for being here and for sharing this information with us. Thank you so much, Dr. Williams.
Thank you so much for having me, and I hope that everyone has a great night and a great weekend as well.
Thank you so much. Good night, everyone.
Good night.
Good night.